The ACT Party doesn't need to be reined in because we're a constructive part of this government. And I want to just reflect on what the Health Minister, the Honourable Simeon Brown, said today. Patients must be at the forefront of everything we're doing in health. And in ACT, we totally agree with that. And I really want to congratulate the Minister on some of the announcements this week he's made around health and the timely quality healthcare for New Zealanders he is trying to deliver, with the uplift in funding for GPs and the real focus on that primary practice, more places in medical schools, and of course supporting our very important nursing community. But what I want to talk about today is what are the consequences when you actually do decide to divide New Zealanders by their ethnicity and actually decide that there are different rights and privileges based on ethnicity. Yeah. And what I'm talking about specifically, Mr. Speaker, is the health regulatory bodies in this country who are using the treaty to justify their ideology ahead of patient well-being and valid science. And that is extremely concerning to me. These bodies have decided how they are going to treat New Zealanders will be based on ethnicity. Sure. Maori versus non-Maori. And that is just not good enough. First, we have the Nursing Council of New Zealand. Now, they put out some standards of competency last year. There's 2 of them, depending on whether you're a registered nurse or an enrolled nurse. They have either 6 or 4 standards of competency. But the first 2 competencies are entirely related to ethnicity and the treaty. So before you even get to patient care, how you actually should be looking after your patients, entirely based on ethnicity. And some of the nurses have told me, they've come to me directly and said they are not looking at staying in nursing because of these competencies. It's requiring them to know te reo, tikanga, describe the impact of colonialisation and actually advocate for culture and spiritual health. Now look, I don't think that's actually what nurses should be focused on. So, you know, we actually think of nurses having the right skills to treat the patients in front of them and actually having a big heart. And now we're actually these bodies are requiring nurses to have the right and correct views on the treaty. Then we've got my other favourite, the Chinese Medicine Council. So this was set up in 2021 by Labour, and it's to regulate the Chinese medicine providers here in New Zealand. Now, this council requires Chinese medicine practitioners to honour the treaty as tangaruwhena, challenge the biases of their colleagues, and enact the principles of the treaty and involve bicultural principles.
Try and figure that one out.
Well, bicultural principles. Which culture are we talking about here? Chinese culture, Maori culture. I mean, really, this is crazy stuff. It's absolutely absurd. Then we've got the psychologists. So the New Zealand Board of Psychologists. Now, I actually was some psychologists came to me late last year, very concerned about this. They were so concerned that their voice would be shouted down and they wouldn't be listened to. They actually couldn't write directly to their own professional board. So I took up their case and actually wrote to them in September of last year, very reasonable letter outlining their concerns, and said, look, actually, some of your members have got concerns and we just would like you to reopen consultation, have it open longer, actually do something. They just acknowledged my letter and just pushed on. They didn't actually listen to their members. So what that tells me is we've got a professional body, this is the New Zealand Psychologists Board, who are actually not providing a safe board for their members or a safe council for their members to actually have their views. That is very, very concerning. I will go on. We've got the Council of Midwifery, who have embedded principles of self-determination, equality and partnership. And again, luckily, Minister Brown is actually looking for some new appointments. Oh, I'm just wondering. Yeah, worried about the treaty then? No? And then the Pharmacy Council, again, they've got to basically, pharmacists need to embed the treaty in everything they do, which is very, very concerning. But we have some good news. Minister Seymour is getting some new pharmacists. So what I've got to say is this, we've got to stop this woke madness. Kiwis engaging in our health system deserve confidence that they are being treated and foremost as humans with individual needs and that their needs will be met on valid science. science. That's what they're wanting. And so I would ask parties to support the Treaty Principles Bill because it actually stops this divide by race.